The day of reaching the destination. Just obeying an inner decision. Embarking on the journey. A precise, comprehensive, and people-benefiting solution for in vitro diagnostics serving the public health. Every inch gleams, condenses into the pulsating ideal. With a determined heart, courage emerges from past steps. Knowledge in motion, only focused on steadfast progress. The compact immune quantification analyzer initiates the self-developed era of Zybio. The eruption of creativity, a rigorous competition with details, a mad breakthrough to the limits. Here we conquer several core technologies. Gene engineering antigens, antibodies, diagnostic nanomaterials, various signal amplifications, rapid nucleic acid extraction and PCR tests. Here, we collide sparks of wisdom, turning each conception into reality, launching a fully independent intellectual property TLA, and automated sample processing system EXLab. Here, we break free from fixed thinking, analyzing the concrete, perceiving innovation, understanding usage habits, anticipating customer needs. Cold modes convey delicate care, lean management in every product detail. Light is not just a bright beam, it is the carrier of energy. Comprehensive is not merely all-encompassing, it empowers precision. The 9+1 product line, encompassing clinical chemistry, clear, POCT, coagulation, hematology, urinalysis, mass spectrometry, molecular, pathology, paired with intelligent laboratory management system, efficiently providing laboratory solutions worldwide. Research centers scattered across the country, connecting Zybio's intelligent network, breaking the technical barriers set by the industry, pulling together the entire industrial chain from raw materials to core components. Establishing the Zybio Technology Park, creating an integrated space for raw material development, research and design, and product manufacturing. Customer service covers full-time, online and offline. We integrate our thorough philosophy into every corner, fundamentally providing integrated, traceable products and thoughtful services. Dedication to accuracy. In the future, belonging to every sincere practitioner, interpreting the endless charm of the in vitro diagnostic industry with innovation, serving the public health with high-quality diagnostic solutions, promoting economic development and technological advancement in the industry. Light, carrying ideals, gathering energy, we, chasing the light, will ultimately become the light.
Ladies and gentlemen, esteemed colleagues and honored guests, welcome to this special celebration of the inaugural DiagHub Online Academic Platform webinar. It is an online academic exchange platform established by Zybio and mainly committed to identifying and discussing emerging trends and experiences in the clinical application of laboratory medicine, gathering and disseminating the wisdom of experts. This platform is organized according to the current discipline of laboratory medicine. Today marks a significant milestone as we gather together to explore the first session of DiagHub. focusing on clinical chemistry, which is co-founded with International Federation of Clinical Chemistry and Laboratory Medicine. Please allow me to introduce the moderator of this event first. Mr. Vincent Mina Abrena serves as the head of the Clinical Microscopy section at the Department of Laboratories, San Lazaro Hospital, Philippines. He is a member of the Ethics Committee of the National Reference Laboratory Research and holds the position of medical technologist within the same institution. With a focus on advanced laboratory practices, he has authored and co-authored several academic papers and professional books, contributing to the field of clinical microscopy and diagnostic standards. His work underscores a commitment to ethical research and interdisciplinary collaboration in laboratory medicine. Welcome, Mr. Vincent Mina Abrena.
Thank you very much for that introduction from, of course, our very own Silaya Wang. I'm very glad to have the opportunity to participate in this academic conference upon the invitation of Zybio Incorporated and the International Federation of Clinical Chemistry and Laboratory Medicine, or the IFCC, and to serve as the host of this session. At the same time, I am also honored to be able to learn and exchange knowledge related to the field of laboratory medicine through the DiagHub platform today with experts from Turkey, Thailand, and China. Next, I will introduce the expert who will deliver the opening address of this session, Professor Dr. Thomas Osben. All right. She is the president of the International Federation of Clinical Chemistry and Laboratory Medicine, also the current executive board member of the European Federation of Clinical Chemistry and Laboratory Medicine, and also the past president. She is a supervisor for the doctorate program entitled Clinical and Experimental Medicine at the Medical Faculty, University of Modena and Reggio Emilia, Italy. The Vice Rector, General Director of the Central Laboratory of the Akdenis University Hospital, and Chair of the Department of Medical Biochemistry. Published over 300 papers, edited several books, and invited to speak at more than 500 international conferences. Please join me in welcoming Professor Thomas Osben for her opening address.
Hello, everybody. It is a big pleasure and honor for me to attend the academic platform of Zybio. As the president of International Federation of Clinical Chemistry and Laboratory Medicine, with our mission advancing excellence in laboratory medicine for better healthcare worldwide. IFCC is a worldwide non-political organization for clinical chemistry and laboratory medicine. We establish global standard settings in collaboration with other international organizations. We support our members through scientific and educational endeavors, and we provide multiple congresses, conferences, and focus meetings in support for laboratory medicine specialists to meet and present original findings and best practices. IFCC has 6 regional federations, and there are 100 full members, 25 affiliate members, and 65 corporate members in these 6 regional federations. The 6 regional federations of IFCC are North American Federation of Clinical Chemistry and Laboratory Medicine, Latin American Confederation of Clinical Biochemistry, European Federation of Clinical Chemistry and Laboratory Medicine, Asia Pacific Federation for Clinical Biochemistry and Laboratory Medicine, Arab Federation of Clinical Biology, and African Federation of Clinical Chemistry. IFCC has 55,000 laboratory specialists as members in these 6 regional federations. The power of IFCC are these. It is a major organization linking clinical chemistry and laboratory medicine societies and federations worldwide. It is a major body involved in development of standards in laboratory diagnostics. It is a major venue for international exchange of scientific know-how in the field. It is a major facilitator of education and communications in the field. IFCC has 4 divisions and several committees, several working groups, and several task forces. And I briefly mention some key IFCC programs, such as establishing global standard settings, also in collaboration with other international organizations. And it supports members through scientific and educational endeavors, provides also distinguished awards, speakers bureau, distance learning program, exchange program, professional management exchange program, and professional scientific exchange program. And IFCC organizes every year either World Lab or Euromed Labs, and it supports young scientists, providing them travel scholarships, and also organizing young scientist forums. IFCC organizes also webinars, and in 2024 it organized 70 webinars bi-monthly, and 150 speakers presented 200 presentations in these webinars, and 225,000 participants worldwide from 180 countries attended these webinars. And the next Euromed Lab Congress will be held in May in 2025, next month in Brussels, Belgium. And we are expecting all of you to these congresses. And the next year in 2027, there is IFCC World Lab Congress to be organized in New Delhi, India. And also there are regional congresses of IFCC. Colombia Clinic organized in 2026, Santa Cruz, Bolivia, Asia Pacific Federation of Clinical Biochemistry in 2027, Kuala Lumpur, Malaysia. And it is very important and for IFCC having corporate members, and one of them is Zybio. And Zybio was established in 2008, but it is growing very fast. And it is providing also services in total laboratory automation, hematology, coagulation, urine analysis, chemistry, CLIA, and also point of care testing. It is providing also microbial solutions and molecular solutions in precision diagnostics. And Zybio is attending also academic activities, and in 2024, it attended 265 academic conferences in various types held in China. And it is also attended 30 academic seminars and workshops in overseas in 2024. And Zybio also established an academic platform which is named Diagnostic Hub. This platform aims to create an international, barrier-free environment for mutual communication and learning, facilitating seamless interactions among medical professionals worldwide. It is organized according to the current disciplines of laboratory medicine, divided into 8 sections, including biochemistry, point of care testing, immunology, hematology, coagulation, urine, microbiology, and molecular biology. It is not only a resource for learning diagnostic knowledge, but it is also an interactive platform for discussion and communication. And Zybio organizes webinar. The webinar schedule of Zybio is shown in this slide from April to September. And in each session, there is one guest speaker, one host, and 2 speakers. So we are expecting all of you to attend those Zybio webinars. Thank you very much for your attention.
Thanks for that inspiring tone for today's webinar from Professor Osman. Let us now delve into the heart of our academic agenda. Our first keynote speaker is Professor Kanita Punsuri from Thailand. Please allow me to introduce her. She is a lecturer and head of the AMS CMU EQA unit of Chiang Mai University, Thailand. She's an assessor for ISO 15189 2022 and ISO 15190 2020. She's a research expertise in health promotion, external quality assurance, material development, molecular biochemistry, and pharmacological activities in Thai medicinal plants. More than 10 papers have been published in reputable international journal and presented at conferences worldwide. Professor Punturi will now share her expertise on risk management in clinical chemistry laboratories from theory to practice. Let's give her a warm welcome.
My name is Dr. Kanita. The topic that I would like to discuss or to talk today is about the risk management in the clinical chemistry laboratory, and actually is clinical laboratory. I would give you a little bit of background information on the risk management, and also probably try to show you how it's important in the laboratory to do risk management. Okay, so you can see this kind of picture here. That this is the picture that I really like to use when I talk about the risk management. So you can see a big apple and small apple here, which may be comparable to the benefit of the patient, to get, or the benefit of your organization to get. In order to get a bigger apple, you might have to take more risks or something like that. So we will talk about this later. At first, I would like to give you a little bit of background information on the definition of the risk. The risk is a chance of suffering or encountering harm or loss. This is from Webster Dictionary. In order to in another word, from the guide ISO 73, they said that risk is can define as an effect of the uncertainty on the achievement, which means that if you have a goal and anything that can make you cannot go to that goal, that you can say that is a risk. From ISO Guide 51, they said that risk is the combination of the probability of the occurrence of harm and also the severity of the harm as well, which is this is two important parameters that we are going to talk later. So in the laboratory, I would say that risk is any potential that error that could happen and could lead to the harm to both patient and staff. Okay, so we can call those as a risk. And in the medical laboratory, normally we have the many detection mechanisms that we use to monitor or to try to prevent all kind of those risks. As you may know, quality control, IQC, EQA, this kind of thing can help detect and prevent the error before they can impact to the patient. Okay, so this is the definition of the risk. So what is the process of the risk management? So this is the conclusion of the risk management process, which I will go through to each step later. Let's take a look at a big picture first. So the first step would be you need to identify the risk. Say that like how many risks do you have in your laboratory? I will show you later how to do that. So once you identify all kind of those risks, then you need to measure which risk is important, which risk is could happen like more frequent, and what is the impact of those risks? Okay, if more frequent and more like high impact, then this is probably is the risk that you need to prioritize, like to make it, to consider that you need to do something with this risk first. After you measure the risk, which this step you can say that this step is the risk assessment, to assess to give them the score and then prioritize the risk that you need to do something with that. After that, you need to try to find a solution, the solution to prevent, the risk is something that not happened yet, right? So you need to try to find a way to prevent this risk, okay? After that, you select one best solution that you that you find, and then implement this solution or procedure into the laboratory. And then if you implement this solution already, you need to monitor after that, monitor the result if this risk happen or not. Okay. So we try to prevent this to happen, right? So, and then you can see the arrow is not the end. So this is the common for the management process. It's not like the end, you need to do like plan, do, check, act all the time. If you in your laboratory, the solution that you implement is not effective, then you need to try to get over, like to do it this step again, to try to find the best solution. So let's take a look at each step, what we can do. So the first step would be the identification of the risk, right? So you need to identify the potential risk, which the question that you need to ask is that what can possibly go wrong in the laboratory process that you have. When we are talking about the risk, most people think only about a fire, earthquake or something like that. But normally, the risk can include in every step, every processes in the laboratory. So you can maybe divide it into like hazard risk, like fire injuries, which is this is probably aligned to ISO 15190, which is laboratory safety. Okay. And it could be an operational risk. This is a normal process that you are doing in your laboratory, anything that you operate. And it also can be a financial risk as well, like economic recession and something like that. And it's also about strategic risk as well, like if there are like new competitors, or it's about brand reputation or something like that. So in the laboratory, normally what I would talk today is only focus on the first two risks, which is a hazard risk, which align with the ISO 15190, and operational risk, which is the ISO 15189. Okay. So, and how can we make a identification of these risks? So normally the organization can identify their risk through many ways. You can use your experience, you can use your internal history of your organization. Like if we are talking about the laboratory, which mean like many documentation that you already have, like you have a record of number of the sample hemolysis, or number of the internal control, which is like out of control or something like that. So you can use your own experience. You can consult with some professional. You can use an external research. And another best way to do is that to interview or to do like brainstorming by, gathering everyone that involved in the process in the lab, and then help, brainstorm, thinking about what kind of risks do we have in our laboratory. So one important thing that I would like you to remember is that some people say that, okay, risk identification, we're going to do only one time, which is not correct, because the environment is always changing. So this step should be revisit regularly. You may do it like yearly, or, I don't know, every 2 or 3 years. It depends on the environment of your laboratory. Okay. So I would like to introduce to you a little bit to ISO 22367, which is a very, very benefit to do a risk management. This is the medical laboratory, which application for risk management only to medical laboratory, but like very specific. I quote here from clause 10.2. Just want to show you what kind of information that you can use to make, to use as information data to think about the risk that we have in the laboratory. Okay, so it could be from the internal source, right? and also external source. Internal source, for example, like the performance evaluation study, the IQC data that you have, the incident report, compliance or non-conformity or corrective action that you already record in your laboratory. This is the internal sources. And also, every year, if you apply, if you apply for ISO 15189 or 15190, you would have to do the internal audit, right? So this kind of report would direct you. This is a very important data that you can use as to make an identification of your risk. For external sources that you can use, such as the EQA report, because you have to, if in order to apply for ISO, you need an EQA report, right? So you have EQA report, you probably have the compliance from the clients, like physician, and some manufacturer advisory notice, regulatory authorities, as well as even database or literature reports, or even like a accreditation body like audit, comments from audits you can use as a risk as well. So if you have time, try to take a look at this ISO. It could help you a lot to do risk management. So another way to think about how to make how to identify the risk is that think about all process that you have in your laboratory. So this is an example that I would like to give you. As you know that normally in the medical laboratory, we divide it into pre-analytical, analytical, and post-analytical process. You can see here the error that could happen at the pre-analytical and post-analytical process would be more than the analytical process here. Because normally right now at the analytical process, we already have the procedure that can prevent those kind of risks already, like you have IQC, EQA, those kind of things. So when you want to make a list of the risks that you have in your laboratory, think about all process, or you can break down every process. So I give you an example here, like how about the sample collection process? There might be like incorrect identification, mislabeling, incorrect homogenization, incorrect blood sampling, wrong tube, wrong anticoagulant or something like that, okay? So those kind of things could be a risk, right? Something like that. So here is just only an example, so you can read this through later, okay? So try to make like try to break down the process of your laboratory and think about each process, what can possibly go wrong in each process, and then make a list, okay? So after you have a list of the risks that could happen in your laboratory, the next step would be to assess how much risk. So you need to give them a score for each risk that you have, okay? So this process you can measure the risk, or you can call risk assessment. So the two parameters that we are normally use is the frequency and severity, okay? So the question that you should ask is that what is the likelihood of the risk occurring? And if it's did, what would be the impact of those risks, okay? Normally people use a heat map. I'm not quite sure, maybe you have seen that before. Using a heat map to represent how much risk for each risk. So using these two parameters, frequency and severity, then you can prioritize what kind of risk, which risk that you need to act first, to try to find the solution first, okay? This is an example of the risk assessment matrix. Like I told you before, the first step, you make a list of the risks that you have, all kind of risks that you have. Maybe you have like 20 or 40 risks, in your laboratory. So which one we should concern first? So you need to give each risk the score, depend on two parameters. The first one is there are many words you can call that: likelihood, frequency, probability. You can use any word. So give them a score. This is an example. Like if it's happen like very often, you give the score as 5. Is like rarely happen, you give the score is equal to 1, something like that. Okay. And another on the another side of the table, you grade according to the severity or consequence or the impact of those risks. Okay. Like the first one, the score number 1 may represent no effect at all or no injury. It depends on the effect, right? And 2 is minor, 3 is moderate, or something like that. If you are talking about the patient safety, so 5 maybe can cause patient death. Okay. I will give you a little bit of example on this. This is an example of how can you grade, each risk. So the definition of grading here for each risk is might be different. It depends on the the context of those risks. So the probability of occurrence that could happen, you can grade like this. Example 1, 5 is equal to more than once per week that happen. You give the score to 5. For 1 is unlikely ever happen at all. You give the score to 1 or something like that. And example 2, you can say that, okay, if it happens daily, like it happens every day, it could happen every day, you can give the score to 5, but if it's happened like only once a year or something like that, so you give the score to 1. So this is an example of probability or likelihood. Okay. The second parameter that I told you is the impact or severity. You can give the score from 5 to 1 as well. Let's say that, for example, you can see here, the score 1 is inconvenient for or temporary discomfort, only the discomfort or something like that. Okay. And then the score 5 is equal to this if the risk happen can cause patient death, something like that. Okay. So this is an example. So let's say if you have like 40 risks in your lab, so you need to give them the score for each risk, give them the score. What is the frequency? What is the severity? And then multiply those scores together, like the frequency is equal to 5, but the severity is only 1, so the score is only 5 multiplied by 1. Okay. But if this risk, one of the risks, let's say that sample hemolysis, it happen quite often as well, and also it can cause patient death if the parameter that the doctor wants is, let's say, like potassium, which is like in the emergency lab, right? It's very if you give the wrong result, can cause the patient death. So in this case is the frequency is equal to 5 and severity is also equal to 5. Is give the score 25. Okay. And then you can see here there is the different color of this. This means that more score is the top one, the top score is that the risk is like very high and is unacceptable. So normally you can use only maybe 2 or 3 color. It depends on you. Some laboratory only use green and red. Some use green, orange, and red. It depends on you. You can select. This is an example how to make a rating of risk. Okay, like 1 to 3, we we say that, okay, this is a low risk, we can accept that. So you don't have to do anything. That means that the system, the process that you have right now, is okay. The risk is like very low. But for medium, this is an acceptable risk, but you can reduce it, you can reduce if you have some procedure, better procedure, you can reduce this risk. For high risk is unacceptable. This is an urgent that you really need to find a solution. Okay. For summarize for the second step is that you need to give the score of each risk that you list from the first step, and then prioritize which one is important. Okay, and then you select the unacceptable risk to do for the next step. Okay, the next step is to examine the solution, to find the solution. So the question would be, what is the potential way to treat the risk of this risk, which you need to balance between being affordable and effective. So as I told you before, that this picture is a good representation of the risk management. The organization usually have many options to do to try to find a solution, right? So you can either accept the risk. Some business, there is, there are already a risk which is inherent in that business. You cannot avoid that. So if you want to do this, you must accept that there is a risk. Let's say that if you want to get this big apple, you must accept that there is a risk, right, to get this apple, because see that is at the edge here, right? You need you have a risk to to die, to fall off, right? Okay, if you think that, okay, this risk, this big apple here is not worth it, it's not worth it at all to do, you can avoid the risk, which means that that process or that business you don't need to do at all, because it's too much risk. When you just make a balance between the benefit that you're gonna get and the affordable, or the risk that you are going to get is is not worth it, so you can avoid risk. The next one is the risk control, which in the medical laboratory we are using this management. We try to find the solution to prevent, which is reduce the likelihood of the risk, prevention. Okay, and mitigation, which is reduce the impact, try to reduce the impact of those risks. Okay, so normally medical laboratory use the risk control to prevent and to mitigate those risks. Okay, another method that people use is the risk transfer, which means that you don't want to do that by yourself. The example of this risk transfer is you buy an insurance. Okay, if you buy an insurance, you may you put the risk to insurance company, something like that. Okay, so in the medical laboratory, normally we accept those risks, and also we try to find the way to control those risks. Okay, that's why we have to try the solution to reduce the likelihood or to reduce the impact that could happen to the patient. Okay. Once you find the solution, now you might have like maybe 10 solutions, to for each risk. Then next step, you need to decide which solution to use to implement into the routine laboratory. Okay, and then you implement those process into your routine laboratory. Okay, so next step would be monitor the result after you implement this process that you think that it can it can prevent those risks not to happen. Then you monitor if those risks happen or not. If it's effective, then you continue those process. But if it's not effective, then you have to rethink again, okay, and choose the better way to prevent. Okay, so that's why I said that for process of the risk management, you need to revisit all the time, every year maybe at least. Okay. So I would like to talk a little bit about medical laboratory. Maybe I'm not quite sure that you are familiar with this or not, IQCP. Like for medical laboratory, like many people try to merge the risk management concept into medical laboratory many years ago. Okay, IQCP is individualized QC planning, which you manage your laboratory based on the risk management. You can see there are three components here. The first step would be risk assessment, which is, as I told you before. And then the second is try to find a control, make a good quality control plan. And then you assess the plan, if is the plan effective or not. So let's take a look a little bit about this IQCP component. Here, the first one is the risk assessment. So you identify the risk. This is the same process that I give you a background before. You identify the risk and then evaluate the potential failure, source of error in your testing process. Normally, they say that, okay, to be easy, this is the 5 things that you need to think about when you think about risk in your laboratory. The first one is specimen. Second one is about the test system. The third one is about the reagent. The fourth one is environment, and the last one is testing personnel, which each job, each laboratory, like clinical chemistry. If you compare between clinical chemistry and probably like hematology, clinical chemistry, most of the tests procedure using an automatic machine. So the specimen test system reagent might be, more important than the testing personnel, right? But for hematology, because you need like an individual competency of the personnel to maybe, take a look at the cell, different type of cell or those kind of thing, which is use the individual competency that in those kind of lab, you need to think about you need to focus on the testing personnel. Okay. So let's take a look a little bit about these 5 group of the thing in your laboratory. I give you an example here. Maybe you can read it later, but I would like to give you a little bit of this. That's all. For the specimen is maybe starting from the patient preparation. Like let's say that if you want to do fasting blood sugar, you need to get the correct sample first. The how to prep the patient properly, something like that. So if you say that there's a problem all the time, that the patient preparation error that happened, you need to find some procedure to reduce the the chance that could happen. Okay, this is the last column is the way to reduce the chance of error that could happen. Like if the patient is in the ward, so no glucose collection after the breakfast or something like that. Okay, the proper tube, not proper tube used, for the specimen collection step, then how to do that, maybe training or those kind of things. So you try to find a way to reduce the chance of error. So this is about the specimen. The second one is the test system is, for example, like expired calibration or incorrect delivery of the sample volume, too much, too low volume or something like that. Okay. The reagent, expired reagent, which happen quite often in some laboratory that's normally, not have test like often or something like that, and the reagent not stored properly. This is also very important. Then you try to find a way. If you see that this is the risk, then you try to find a way to prevent this risk. Okay. The environment, for example, the specimen drop or spill, for testing personnel normally is about untrained staff or maybe not enough staff, like increase the staff turnover or not enough staff. I'm not quite sure. Maybe each laboratory has a different environment. So you can use your own problem in your laboratory to make as a risk and try to find a way to reduce the chance of those errors. Okay. Okay, let's come back to the second step for IQCP. Risk assessment, you do like making a list of the risks, right? According to these 5 area. And then you make like, as I told you before, you prioritize those risks, give them a score, prioritize, and then try to find a solution, The second step is try to make a good quality control plan, which is try to find a solution. So this may be like try to use an electronic control, try to use internal control. For clinical chemistry, you need internal control to see how, like variation of the, the error that could happen, right? The precision, how good precision in your machine, right? And also you need to do the proficiency testing or EQA to see how accurate your lab, your lab test or something like that. So, and also you need the correct calibration, you calibrate the machine, and you make like a regular maintenance, which there are so many type of maintenance, right? About personnel, you may need to train regularly training the staff in your laboratory, and also to assess their competency as well. So this topic is the control that you try to put into your lab to prevent the error that could happen. Okay. So the third one is, once you implement this control into your lab, then you need to monitor if this process that we set up is working or not. Is it effective or not? So the data that you could get from this is that you can see it from the IQC result, if there is like out of control often or not, the EQA performance, or you can see at the chart review. You can see for specimen collection part, you can see the specimen rejection logs, how many hemolysis that you get after you launch the procedure that can prevent the hemolysis or something like that. Okay, you can also take a look at the turnaround time report in your lab as well, and also compliance report as well. So this is how to monitor. You can see that the arrow here is, is continue. The process of risk management is a continued process, no end procedure. You need to improve all the time. Okay. So the last part of my talk would be, I would like to show you a little bit about ISO 15189 and ISO 15190, which focus on the risk management. So in clause 5.6, there's like a specific, they like very emphasize on risk management. They say that laboratory management need to establish, implement, and maintain the process for identify the risk of harm to the patient. So take a look at this a little bit. For ISO 15189, they focus on the patient harm, okay? Is the risk that can harm to the patient, which is error that could happen in the lab would affect to the patient, would affect to the patient, mostly to the patient. Another word that they use here is the opportunity for improvement or improve the patient care. We will talk about this later in a little bit. Let's say that At first, you need to identify the risk and you need to develop an action, like I told you before on the basis that you need to develop an action to, try to prevent those risks, okay? And evaluate the effectiveness of the action that you actually do it to prevent those risks, okay? So in this ISO, in this one, you can see note 1 and 2. As I told you before, that the ISO 22367 is very, very good ISO that you can use as a guideline to manage the risk in medical laboratory. And also there's another ISO that you can take a look, is ISO 35001, which is talking about biorisk management, okay? So here is the another part, which is the management part of ISO 15189, which is you can see at the clause 8.5. They focus, mainly on the action, how to address the risk and opportunities for the improvement. Okay. Do you still remember the big apple that I said, that I showed you at the beginning, the big apple? In order to get the big apple, you need like probably you need to invent the way, right? The same way to get those big apple. So that I would say that those are the opportunities for the improvement. Sometimes you need to dream big to get something bigger. So this would be a room to improve your lab to get to the the bigger target. Okay, so you not only to how can I say, not only to prevent the common risk, but you maybe think about the bigger one, the bigger benefit, more benefit things. So there's a room to improve. I'm not quite sure that in the medical laboratory, maybe people familiar with the word CQI, continuous quality improvement, right? So you need to improve all the time, the process and improve your process all the time to make your work easier and more effective, more efficient, right? Take a look a little bit about clause 8.5. You can see that the process is the same as I told you before to identify the risk, right? And then acting on risk, which is you need to prioritize, right? It depends on the impact, the potential impact on your patient, the focus on impact on the patient, and also you need to think about the personal safety as well. Okay. So here there is note number 1, 2, and 3. You can see here that there are many options to address the risk. See that you can avoid the threats, like I told you before, eliminate the risk source, reduce the likelihood or the consequence of the risk, right? You can transfer the risk to other people, right? Something like that. So this is just the way to do, that's all. And these 2 ISO that you can use. And the opportunity for improvement that I told you before can lead to expand the scope of your laboratory activities. You can apply a new technology or creating other possibility to fulfill patient and user need. So this is also very important if you can do it in your lab. That's ISO 15189, which focus on the patient safety, patient harm. So for ISO 15190, there is a clause that focus on the risk assessment as well. You can see here is about hazard. So the first one would be the hazard identification here. Hazard identification and the risk assessment. So first you need to identify it. My slide, the second. I have a little bit of problem. Okay, it's come now. So you can see the clause number 6 is about hazard identification and risk assessment. any hazard material that you have in your lab, you need to make a list, here. So all kind of risk assessment you should do, using the similar procedure that I told you before. And you also need to think about the job hazards assessment as well, identify the critical step, identify the all kind of equipment, potential hazard that you use in your lab, And they said that the employee is very important, the key participants to help you identify, the risk that exists in the process of their work. Okay, so you can use like brainstorming in this case to help, making the list of the hazard or of the job hazard. And clause 6.3, you can see this is the focus on the risk assessment, which the procedure is the same as I told you before. So you need to assess the risk, and then prioritize it, and then try to find the scenario, the way to prevent, the negative outcome, right? Using the same parameter to prioritize likelihood, consequence, and you try to find a control, those kind of things. Okay, so it's the same thing, but just focus on the people who work in the lab for risk assessment, and also the environment that you can cause a problem with the environment as well. So see that risk assessment, you can use the probability and the severity, to do a risk prioritization. And clause 6.4, they're talking about the risk reduction to reduce the risk as much as possible by using various ways like elimination, substitution, containment, or you need to make the BUI, work instruction with safe instruction and training, like training regularly or something like that, or encourage people to use the PPE, to use the correct equipment or those kind of things. Okay, and then you need to carefully monitor the plan that the process that you already implement into your lab. Okay, so I think that's it for the risk assessment in the laboratory. I would like to conclude in this slide. So this is the risk assessment flow chart. So you begin with identifying the risk first. You make a list, identify the risk, and then maybe you identify the people who are at risk. If it's about hazard, maybe mainly focus on the staff in the lab, right? But it's about the lab error, so must be focused on the patient or something like that. So, and then the next one is another parameter that you can do is to identify the existing control measure, like do you have an internal, let's say that the lab error, the accuracy of the lab is not good, something like that, the lab error. If you focus on that, maybe you can say that, hey, how much control do we have? Do you have a good way to control, like to do an internal control, and do you also apply for external EQA, external quality control or not, or something like that. So, and also evaluate the risk, which is the to give each risk the score, and then prioritize, use likelihood, severity to calculate the risk, and then you give like a score. Each risk have like their own score, like very low, medium, high, or whatever, and you select to manage this risk depend on the if it's high risk or unacceptable risk, you need to implement the good way to prevent those risks not to happen or something like that. If it's some risk is very low, this acceptable, you don't have to do anything or something like that. Okay, so that's it for my presentation, I guess. Vincent, thank you for your attention.
Okay, so once again, thank you very much, Professor Punturi, for that very insightful presentation on risk management. And I think I'm craving for apples right now. It's very wonderful, presentation. And as you all know that a while back, I was also taking down notes because I am also a personal of the laboratory, and of course, this your topic was very relatable, and of course, we have to go over to our ISO, like the ISO 22367/2020, which is the application of risk management to medical laboratory, and the details of which is for the managing risk in the medical laboratories. While on the other hand, the ISO 15189/2022, it has the details for the laboratory biorisk management. And of course, and another at ISO 15190/2020 for the hazard identification and risk management. And of course, I really enjoyed the what do you call this? The risk assessment matrix that you have presented. It's very helpful to our medical technologists, by the for a good laboratory practice. And by focusing on these areas, clinical laboratories can improve risk management practices, enhance patient safety, and ensure higher quality laboratory services. So once again, thank you very much for that very insightful presentation, Professor Punsuri.
Okay, thank you.
So moving on with the next speaker. And again, I'm going to introduce to you. She is the manager of the reference system department of Zybio Incorporated, a member of the protein detection working group of the National Technical Committee for Standardization of Biochemical Testing. She engages in standardization research projects organized by international and domestic metrology and inspection organizations, primarily responsible for traceability of measurement values in vitro diagnostic products, development, and application of reference methods for isotope dilution liquid chromatography tandem mass spectrometry, and the construction and accreditation of reference measurement laboratories. Mrs. Wang will now present the traceability of quantity values for biochemical detection items. Please welcome her.
Thank you, Vincent and Dex, for your kind introduce. Hello, everyone. I'm Wang Junqing from Zybio Inc., and I'm very glad to have the opportunity to speak at this reference. Today, I would like to do my presentation about the traceability of quantity values for biochemical detection items. My presentation will cover the following aspects. 1. IVD manufacturer plays an important role in metrologic traceability. 2. Zybio has been researching the metrologic traceability for many years. And 3. How to do the metrologic traceability of quantity values for biochemical detection items. At last, we have some thoughts and discussion of metrologic traceability in IVD manufacturers. At first, I will explain a term, metrologic traceability. In ISO 17511, this term defined as the property of a measurement result whereby the result can be related to a reference through a documented unbroken chain of calibrations. And in laboratory medicine, traceability means the sample results measured by any IVD measurement devices can trace the value to the international reference such as reference measurement procedures or reference materials. Then, why is metrologic traceability important in laboratory medicine? In laboratory medicine, the objective of examining a measurement in a human sample is to produce a result that will enable a clinician to make the right diagnosis or to assess the risk of disease and make treatment designs for a medical condition. As we can see, traceability in laboratory medicine is the driver for accurate results for patient care. And furthermore, it is the quality requirements of laboratory according to ISO 15189. In this document, it is clearly stated that the laboratory shall establish and maintain metrologic traceability of its measurement results by means of a documented unbroken chain of calibrations. And the laboratory shall ensure that measurement results are traceable to the highest possible level of traceability. To be clinically useful, the results obtained from a given human sample examined by different laboratories or among different methods should be equivalent and accuracy, because equivalent results allow uniform application of medical design limits at reference interval, which can reduce the risk of harm caused by medical designs based on non-equivalent examining results. It is also important for the analysis of the results in medical records for the purpose of supporting clinical designs and for conducting epidemiologic investigations. It is the responsibility of the laboratory to provide accurate results considering precision and trueness, and it is also the responsibility of IVD manufacturers to provide accurate products for those laboratories. But in some conditions, different labs give different results on the same sample because of method design, specimen requirement, or some other reasons. Then, what should we do when we want to get the equivalent result? I think the best way to solve this problem is establishing metrologic traceability of the value assigned. This is the whole metrologic traceability chain in ISO 17511. It describes the calibration hierarchy and the sequence of value assignment. The metrologic traceability depends on the availability of higher order reference measurement procedures or reference materials published by a metrologic institute. The manufacturers use the higher reference materials or reference measurement procedures to assign values to their selected measurement procedure and working calibrators, then transfer the value to the end-user calibrator. Sometimes, IVD manufacturer has established a reference measurement procedure for expanded responsibility. As we can see, IVD manufacturer plays an important role in metrologic traceability to ensure the accuracy of IVD products. Zybio began to produce IVD products since 2008 and set up the reference department in 2018, which meets the requirement of both ISO 17025 at 15195. Our lab has obtained the CELAS accreditation certificate in 2021, and we have 70 analytes has been certified. We have established effective reference measurement procedures based on the recommendation of JCTLM. We established the RMPS by spectrophotometer in 2008, and we established the RMPS for blood cells in 2020. From 2021, we used the LC-mass to establish the RMPS for hormones or metabolites. Up to now, more than 200 products traceability have been established for biochemical, luminescent, clinic, and POCT. We provide more accurate products and service for end users. In addition, we also actively participate in international professional conferences and scientific research collaborations. We joined the JCTLM and a stakeholder member in 2023, and 9 neurons were listed in the JCTM database for reference measurement service. We also obtained certificates for glycosylated hemoglobin organized by IFCC and NGSP. Besides, we took part in the RENA experiments annually. And this picture shows some equipment for reference measurement procedure that used to do the routine method traceability. All the works we do is to evaluate the ability of our lab to do the metrologic traceability for IVD products and ensure the accuracy of the tests. Then how to do the traceability for IVD products? At first, there were some requirements for traceability. First, you need stable detection systems, including biochemical analyzer, reagents, and calibrators. Then reliable traceability standards such as reference measurement procedure or reference materials also be necessary. We built strict internal QC system to control the traceability process. It is also necessary to have SOP and professional personnel to do the standardized assignment process. And we have traceability documents that record the calibration hierarchy. All the above factors constitute a complete traceability system to ensure the accuracy and the effective. Then we make the traceability as the guidance of ISO 17511. In this document, there were 6 cases with different metrologic traceability tree. What we need to do is to identify the traceability type of neurons and choose the correct traceability tree. Here, I will share some of our experiences in traceability for different neurons. The first type was cases with reference measurement procedures and primary reference materials. In these cases, the highest RM and RMP were available. Take the uric acid, for example. This neurons has primary CRM fulfilling the requirement of ISO 15194 and has primary RMP fulfilling of the requirement of ISO 15193. We used LC-mass that calibrated with CRM and assign the value of working calibrator. Then the value of end-user calibrator should be assigned by working calibrator to get the traceable and accurate results. The second type was cases with a primary RMP that defined the mail round. This type was particular for enzymes. In these cases, there was no available RMs. We used RMP to assign the value for working calibrator and transfer to end-user calibrators. The third type was cases for mail round defined by our RMP calibrated with a particular primary calibrator. The traceability of glycosylated hemoglobin belongs to this type. The process of this type was the same as the first one. The only difference is that in such cases, the RMP detects a quantity that is a component of the mail round instead of the whole molecule. The fourth type was cases with an international convention calibrator that defined the mail round. In this type, an international convention calibrator which conforms with the requirement of ISO 15194 was used as a higher order reference. And the fifth type was cases for mail rounds with metrologic traceability only to manufacturers' interval arbitrarily defined RMs. All the above traceability chains can be fit for all of our quantitative products. And for biochemical traceability, there were some tips should be noticed. The biochemical detections is mainly based on both closed systems and open systems. Closed systems means analyzers, reagents, and calibrators are all from one manufacturer, and open systems refers to those three can be matched with different brands. For open systems, the assignment of a set of calibrator is not applicable to all detection systems. So each detection system must establish the traceability separately. In our lab, we make the traceability both on our closed systems and open systems, such as Hightouch, Beckman, Siemens, Abbott, Roche, and so on. At present, more than 100 items of biochemical detection has established traceability. 60 mail rounds has been traceable to RMP, of which 10 has been certified by CELAS, and 9 has been certified by JCTLM. And also 38 mail rounds has been traceable to reference materials. For metrologic traceability, satisfies basic clinical needs and improves patient care, but the details for implementation of the process continue to be a challenge. One of the problems is the available reference materials or reference measurement procedures will not exist for many mail rounds. There are over 4,000 clinically relevant analyses measured in laboratory medicine, but the JCTLM database holds only 295 certified reference materials and 201 reference measurement procedures. So, while standardization may not always be achievable, it should be possible to achieve method harmonization. We also can use the network, reference material, labs, laboratory quality system, including accreditation, or join the proficiency testing schemes to ensure the accuracy of results. We continue to do traceability for our products, as always, to provide more accurate products for end users. Thank you for your kind attention, and we warmly welcome you to visit Zybio in Chongqing, which is a magic 5-dimension city. If you have any questions, I would very happy to answer it. Thank you very much for your kind attention.
Thank you very much, Mrs. Wang, for that very for shedding light on the cornerstone of diagnostic accuracy, particularly on the traceability of quantity of values for biochemical detection. And of course, again, I was taking notes lately, and of course, as a wrap up of that topic, I think with that in mind, traceability of quantity values in biochemical detection refers to the ability to link measurement results, stated references through an unbroken chain of comparisons. This concept is crucial in ensuring reliability, accuracy, and consistency of biochemical measurements, particularly in the field of clinical diagnostics. All right, so moving on to our next part of the agenda, which is the question and answer portion. And of course, I have to read questions from our audience randomly. First question for Dr. Punsuri. The question is, what should laboratory do to maintain a better traceability? Doctor?
Is that about traceability?
Also for Mrs. Wang instead.
Can you ask again, please? I could not hear you properly.
Oh, okay. So, Professor, what should laboratory do to maintain a better traceability?
To maintain
Yeah.
the traceability.
Okay, yes. That's the question from our dear audience.
Uh-huh.
Yeah. So
I thought the traceability is another professor, but if they ask me, like I told you, if you actually in the laboratory need accuracy and precision, right? So your test result need to be accurate and precise, right?
okay, thank you very much, Professor. For our next question, we'll now move on to our next question. For you again, Professor Ponturi, is quality control part of the traceability chain? Is quality control part of the traceability chain?
So as you can see from the traceability chain over there, you can see that the quality control is one of them, is part of the traceability chain. Yes.
Okay, thank you very much, Professor Ponturi. So next question is for Mrs. Wang. I have to go over for that question. So for Professor Wang, why do results vary For some items between different manufacturers, even they have the same traceability method.
Okay. I think there are some factors for these questions. First, it is differences in testing methods for different manufacturers. They may adopt different testing methods, such as immunoassays or chemiluminescence. These methods are based on different principles and technology, which can affect the accuracy of the results. And second, it is the product quality factors. We think the stability, purity of reagents, and quality control during producing can also influence the accuracy of the results. So poor quality products may yield inaccurate results. And third, although some test results can be traced back to a unified standard, but not all test items have a uniform traceability systems. For complex substances, due to their large molecular weight and complex structure, they may interfere with testings. For example, certain tumor makers such as C199 and C125, they lack a universal recognized traceability system, so they can lead to variation in results according to different systems. Okay.
So
Okay, that's all my
thank you very
answers.
much. Yeah, thank you very much for those wonderful answers. I hope our audience are satisfied, and of course, yes, for those queries, So I think that wraps up our today's activity. And for now, I would like to give insights for this webinar. And thank you very much, Mrs. Wang. For today's webinar, has celebrated the launch of DiagHub with profound discussions on risk management, traceability, and innovation in clinical chemistry. My heartfelt gratitude to our esteemed speakers, Professor Osben, Professor Pongsuri, and of course, Mrs. Wang, for their invaluable contribution, and to all participants for your active engagement. Once again, my heartfelt thanks. And of course, in Zybio DiagHub, I think learning is very holistic. Thank you.
Thank you.
Thank you, Mr. Vincent Mina Abrina. This concludes our inaugural DiagHub celebration. Thank you for joining us, and may your work continue to inspire excellence in laboratory medicine. The webinar will be recorded and shared on our official YouTube channel. If you're interested, please subscribe to our channel. So goodbye for now. See you in next session, Immunology in May. Goodbye.
Bye.